Now, it is a strike here in France that has already seen thousands and thousands of public servants, many of them railway workers, walk off the job, causing chaos. Huge strikes then about proposed changes to pensions here. So far, most hospital staff have not striked, but today that is set to change with some junior doctors and other health staff also joining in. Local GPs also planning now to start taking action at the end of the week. And all that follows as well strikes in hospitals across France last month. Some top-ranking frontline doctors then taking action to denounce conditions, saying French hospitals are facing a real emergency. Well, with me here on set is the head of the digestive cancer treatment department at Paris' Pompidou Hospital, Julien Taieb. He was one of the country's top doctors taking part last month and taking part today as well. Thanks very much for coming in and talking to us today. Let's talk about today, first of all. Hospital staff taking action. I mean, obviously that really directly affects the lives of people, doesn't it? Presumably operations cancelled as well.
Yeah.
Why do you think that's justified?
Yeah, I think French health system was a model and is still a model, and that's why we don't want to lose it. And currently, for the first time, we see nurses leaving the hospital, beds closing more and more often. And during the last month, for example, in the pediatrician hospital close to mine, Hôpital Necker, they refused more than 100 patients, babies and children in intensive care unit because of a lack of nurse and bed. So this is completely new in France. We have reached a point of major crisis, and that's why people like me that are not really trained to strike or to demonstration are now involved in this movement to make this stop as soon as possible.
I mean, at the moment, it's just one day, isn't it? But presumably this could get worse. Isn't that going to make the situation in the hospitals even worse?
There was one day on demonstration of November. We are going to do another one next week. But currently, there is a strike in the hospital. We are not giving the administrative people the way of taking the money from the social security. So we are a bit blocking the system because we don't want to take in hostage our patient and to make like deaf hospital days or stuff like that.
Yeah, I mean, you don't think it goes as far, though, as putting lives at risk by going on strike?
It may be the case because when you have to choose between two patients to give the intensive care unit room of our bed to one of them, maybe the other one has a lack of chance. I don't know. We hope not for now, and we want really to ring the bell now to everyone. But it may be the case in some specific situation.
I mean, one of the things that's been very noticeable, isn't it, that far more senior doctors, as you said, that people who are really not used to striking in the past are actually standing up and saying, this is no longer acceptable.
Yeah, exactly. This is completely new. This is really not our culture. We are here to help people to serve the public health, and we are not here to make strike. But this time, it's just that, like we are in contradiction with our Hippocrates swearing and on the other side, the reality of our daily practice. I know we are very lucky in France as compared to many countries, and this is also the case in many European countries, but we really want to keep this health system and not to change, and to have more young nurses, to keep young doctors in public hospital and not to move to a complete private practice, like in some countries.
That was going to be exactly the next thing I was going to ask you. I mean, I'm from the UK, where everyone's full of praise for the National Health Service, but having seen the health service over here, I mean, you do feel like it's much better funded. A lot of our audience also American, of course, where health cover costs an absolute fortune. I mean, do those two systems not show perhaps that actually France is lucky and has been very lucky?
Yeah, I agree with you and with what you've said, but I would say that in UK it went really down, and now little by little it's improving because I think authorities have accepted that it's too hard. I would say that the US is completely different. It's a pure private practice system, even if there is Medicare, etc. We can see how bad the general health is done for the patient, except of course if you have super insurance and incomes.
But where do you draw the line though? Because the amount of money that hospitals can use and can suck in for drugs and treatment and keeping people in hospitals, I mean, there has to be a limit, doesn't there?
Yeah, but this is politics. We have given 100 billion to big companies to help them to increase employment. This 100 billion would have solved the problem of health in France for 25 to 30 years. So this is political choices, and we think there is money in Europe and in France especially, and we can use it better for the collectivity than for increasing the incomes of the richest.
You mentioned there that, of course, you had this big strike day back in November where you were calling for saying basically that the system was under crisis. Nothing to do with the strikes here today.
Yeah.
But do you think that you actually managed to achieve anything by taking that action in November?
So the problem is that the budget of the Social Security was voted last month. That's why we decided to move to this track at that moment. It's true that the calendar is not perfect because there are many different movements ongoing currently in France, but in a way, even if we cannot support the current movement as a collective because we have many opinions in our group, in our movement, I think all these things are linked. I mean, the Social Security is paying the retired people, is paying the health, and is paying the unemployment. So this is the same money at the end of the journey.
And what do you think morale is like in hospitals? I mean, we've seen, for example, the suicide rates, haven't we, amongst hospital staff and doctors going up as well. I mean, do you think that is a part of the general malaise?
Yeah, I think I don't know how to say that in English. I think in French we say a contradictory injunction. You know, sometimes you have to go in that direction, but also in that direction, and this make non-doctors, but also nurses and others, super uncomfortable in their daily practice. And this may lead at the end of the story to suicide in the worst cases. Let's hope not too much.
And where do you think this is going to go in the future? I mean, obviously, an awful lot of people at the moment who perhaps aren't involved in the strikes, a lot of people in this building as well, wondering how on earth they're going to get to work between now and Christmas. But I mean, do you feel that if there are no concessions from the government over the pensions particularly, and if there is no more money and way of finding ways of funding health services here in France, that things could get worse?
I think, yeah, we really do not want to take the patient as hostages. All the emergency health problems will be managed by us for sure, but maybe we will have some more strong action if the government is not listening to us. We need really to increase the income of the poorest salary. We need a more 4% increase in the budget and not 2%, and we need to open bed where we need bed.
Julien Taieb, thanks very much for coming in and talking to us today. Julien Taieb, who works there at the Georges Pompidou Hospital. Thank you very much.
Very much.
So let's have a look at the main headlines then.